Greetings, people of the world. Good morning, good afternoon, good evening. From wherever in the world you are joining us, welcome. If you can hear the sound of my voice, that means that you have been invited to From Program to National Asset, Planning the Future of Your FETP, a practical webinar for FETP directors and Ministry of Health and National Public Health Institute leaders on planning for institutionalization, strengthening sustainability, and maximizing long-term public health impact. I am your host, Ken Johnson, here in Atlanta at CDC headquarters. And this is our first FETP sustainability webinar for 2026, and we have more planned. On today's show, you will hear firsthand from FETP program directors, Ministry of Health, and National Public Health Institute leaders about their institutionalization journeys. And you will learn some practical approaches that countries are using to strengthen national ownership of their FETPs through institutionalization planning. What you will gain from this webinar is you will get real-world perspectives from FETP leaders on achieving institutionalization, lessons learned from countries working to build sustainable country-owned FETPs, practical ideas you can apply to strengthen your own program's future, key elements of FETP institutionalization planning, strategies that support long-term FETP sustainability, experiences from FETP leaders who have advanced national ownership of their FETPs, and priority actions to strengthen the future of your FETP. Now, as I said, this is the first of many webinars that we have planned, and for each webinar in sustainability, I plan to open up with what I call the sustainability statement. And hopefully it'll be given by a different person each time, but it's sort of like a personal statement, just sort of like a personal thought from the person presenting the statement about FETP sustainability, just to kind of set the tone. It can be provocative, it can be thought provoking, it could be a question, just kind of whatever. But here we go with the first sustainability statement. When people talk about sustaining an FETP, the conversation often begins with funding. Funding is important, but sustainability is about much more than keeping a program alive. True sustainability means ensuring that your FETP continues to make a difference year after year. It means the program remains relevant, effective, and able to adapt to public health priorities, leadership, and resource changes. That does not happen by chance. It requires planning. Sustainability is built through many strategies: developing national leadership, strengthening internal capacity, securing diverse sources of support, integrating the FETP into Ministry of Health or National Public Health Institute structures, and demonstrating the program's value as it serves the country's needs. This is where institutionalization comes in. Institutionalization is one of the few aspects of sustainability that you can actively plan for. It isn't the destination, It's the process that leads to the destination. Institutionalization is the work, sustainability is the outcome. So as you participate in today's webinar, I encourage you to think about one question. What can we do to move our FETP one step closer to becoming a nationally owned, sustainable asset? Let's begin building that future together. All right. So tell me if this is a familiar scenario. You've launched an FETP, whether it's frontline, intermediate, or advanced. The program begins training field epidemiologists or surveillance officers. Your trainees begin investigating outbreaks, responding to public health emergencies, and strengthening surveillance systems. Over time, your FETP grows into a successful, valued program. But success brings new questions. How do you keep that momentum going? How do you continue improving FETP? How do you recruit and train the next cohort? Who will lead the program in the future? And perhaps the most important question of all, who will sustain and finance it? These may sound like simple questions, but they have complex answers. Planning for the future of FETP means thinking beyond today's activities. It means anticipating challenges, recognizing opportunities, making strategic decisions, and building the partnerships that will build and support the program for years to come. So where do you begin? The journey toward FETP institutionalization isn't a checklist, and it clearly isn't a one-size-fits-all process. Every country follows its own path, shaped by its own public health system, priorities, and resources. Yet, despite those differences, common themes consistently emerge. Ultimately, the goal is for your FETP to be recognized as a national asset, an essential function of the public health system, with strong leadership, effective governance, sustainable financing, and a clear career pathway that attracts, develops, and retains skilled field epidemiologists. What practices have proven successful? What challenges have others faced? What lessons can help guide you on your own journey? In this next video, you will hear from FETP program directors, Ministry of Health and National Public Health Institute leaders, and resident advisors as they share their experiences and perspectives on building sustainable FETPs. In an increasingly interconnected world, the importance of robust public health systems cannot be overstated. The field epidemiology training programs, or FETPs, are critical in strengthening these systems by building the capacity of field epidemiologists across the world. These dedicated professionals are at the forefront of detecting, responding to, and preventing outbreaks, ensuring the health and well-being of communities worldwide. To further support the growth and institutionalization of FETPs, the CDC's Global Workforce Development Branch, GWDB, has taken a proactive approach. Our work group is dedicated to developing a comprehensive repository of guidelines, resources, tools, and workshops that promote the sustainability and institutionalization of FETPs. This ongoing initiative recognizes the unique context in which each FETP operates, and we are committed to learning from the diverse experiences and practices of countries around the world. As part of this effort, GWDB has engaged with several countries to gather insights from key stakeholders aiming to highlight the successes, challenges, and best practices of institutionalizing FETPs. We have produced an informational video on FETP institutionalization and sustainability, which features interviews with representatives from ministries of health, national public health institutes, FETP resident advisors, and FETP regional networks. These interviews share perspectives on the critical factors that have been pivotal in the successful institutionalization of FETPs. Join us on this journey to strengthen public health systems globally. Together, we can work towards sustainability and institutionalization of FETPs to continue safeguarding the health of communities for generations to come. For more information, resources, and to get involved, please visit our website or contact Global Workforce Development Branch directly. Thank you for your continued dedication to advancing public health.
The most important thing for the countries who want to establish FETP, first, the institutionalization.
The most important part for an FETP to keep getting stronger is having good partners.
Firstly, it's around the buy-in from the government.
Hay que hacer una planeación específica para la institucionalización y depende de cada país. Si no la tienen, realmente lo que empiezan a hacer son actividades aisladas.
The public health system was run by specialists from other countries, from Europe. So there was need to sit and think about what are the needs for public health practice in Zimbabwe.
At the beginning of establishing an FETP program, the development partners, if they could have developed an agreement with the Malawi government, the Ministry of Health, so that at a certain point, the government should take over the program.
The process started with the first meeting of sharing with all stakeholders the purpose of the training, agreeing on which role each stakeholder in them play.
The FETP is housed at the Public Health Institute of Malawi, and the staff that is managing the FETP in Malawi, they are all government staff. We have funding, mainly from CDC, but we also have funding from other development partners.
The program is housed within the National Institute for Communicable Diseases of South Africa.
Insertamos el programa de formación de epidemiología de campo, ya sea frontline o intermedio, en la misma dirección de epidemiología con el mismo personal. Algo que era parte de las funciones y de las labores de epidemiología de la dirección de epidemiología en el ministerio.
La red facilita el intercambio de las experiencias entre los estados. También facilita el reconocimiento de los hitos que van estableciendo los otros y cómo lo consiguieron.
We needed some help of the national strategies and international strategies for paying their salaries. And the first thing we did for institutionalization was arranging their salaries inside of a national institution.
Lo más sencillo era siempre pedir dinero o apoyo financiero en los organismos internacionales, pero sabíamos que eso no era una opción viable a largo plazo. La única opción viable era que fuera parte de las actividades del ministerio, y eso fue lo que hemos logrado ya.
There was a commitment from the government to fund certain elements of the operations of the program.
So that at the beginning, they lay out all the roles and responsibilities, and how the government will be able to sustain the program. So I would advise any other country to take it as a process, work with the institutionalization tool to make sure that it is done properly and gradually.
Our program started in 1988 due to the importance of public health and the importance of epidemiologists at that time. So this is one of the factors that lead the Ministry of Health itself to find this program, such a program, to building the capabilities within their departments to enhance and improve the public health departments.
In the African setting, they couldn't do 2 years of training without giving a certificate. So we needed to be in partnership with the university.
There was an agreement and collaboration between the US CDC, also Ministry of Health, and King Saud University. The King Saud University provide a certificate for the program, so who graduate from the advanced FETP in Saudi Arabia, he will be certified as a high diploma. It's equal to academic master, because after the graduates, they will get promotion.
It's not something imposed on them, dictated to them. It's something they want to do from their own perspective, so that they become champions of sustainability themselves.
Titulación directa, sin necesidad que sea a través de una universidad. Y es como mantener a los tutores ligados al proceso, no por un incentivo económico, sino por el incentivo de generar capacidades.
After a couple of years, the program advertised themselves.
The work that the fellows do during the training, I think that's an important piece. That also, contributes to the institutionalization of the program. Because if the different players, the government and other partners, they see the contribution that the FETP is making to improving the public health of the country.
Es un trabajo constante que se ha hecho desde la coordinación del programa, de ir reuniendo a los tutores, volviéndolos a enganchar en los procesos, dándoles escenarios de capacitación, dándoles otros incentivos que no necesariamente son económicos, el reconocimiento muchas veces público de sus tareas, el hecho de acercarlos como fuerzas de trabajo para determinados momentos. Entonces, de manera activa se han mantenido, pero no es un salario lo que los motiva. Es más esa red que hemos constituido de manera silenciosa y desinteresada, lo que ha sido exitoso.
Cuando un residente entra al programa, independientemente del nivel, se procura que firmen una carta de compromiso para que una vez graduados permanezcan algún tiempo dentro de la institución y que puedan aportar con sus conocimientos y su competencia al fortalecimiento de la vigilancia y también de la respuesta a emergencias de salud pública.
It's really important to show our results to the population and to the managers and to the decision makers, so they can invest and they can believe our FETP as a national policy. Telling our government, our managers, what is the impact of having an FETP inside of our country? Like, what are the results we have, the outbreaks we investigate?
En términos económicos, es decir, ¿cuánto pierde un país por una epidemia? ¿Cuánto pierde un país por un brote? En términos de vidas humanas, pero también en términos de discapacidad y también en términos económicos.
Sometimes we are not known because we are not showing what is the good work that we have been doing inside of our FETPs. So not only the outbreak investigations, but the big numbers of alumni, the differences that someone feel when get inside of the program, and then when it leaves the program, how is it the impact we cause in the professional lives of these people?
Countries should lead the process themselves. So they should understand what they want to do and lead that process so that they can convince their own structures about the need to do a training.
High-level political will from the leadership of either NPHI or ministry, wherever the FETP is housed, to be able to sort of push the process.
The other challenge is really within the ministry, changing leadership. We're making sure that everybody who is coming as a new understand why people are putting their time to train others.
Making the decision makers believe that putting money inside of the program or investing in the program can give good results to the country.
It was to start with institutionalization retreats, because our institutionalization retreat came in almost 3 years after we started the process.
When we are field epidemiologists, we kind of don't understand the importance of showing our results to everyone, of making good recommendations and to put this outside. So showing the work is a big challenge because we need to make good advocacy of the program.
That's why we need better documentation of what we are doing so that we share with the different generations. Yeah.
Because once there is a political will at the top end of the government aspect, it's easy for institutionalization to go on smoothly.
Que la familia del FTP es una familia maravillosa, son personas muy reconocidas, son personas aceptadas. Técnicamente su opinión es válida y eso es sumamente importante. Por encima de cualquier diferencia que pueda haber, la opinión de un epidemiólogo de campo siempre se va a respetar.
All right. Let's talk about this. There were many themes all throughout the video. And I guess I guess we can respond either using the chat or you can come off the mic, but does any of that resonate with you? Big theme, institutionalization. But I also heard partners, having good partners, getting government buy-in, political will, government ownership, changing leadership. Now, speaking of changing, this video has been through a long journey. We actually started the video 2 years ago with the interviews and getting all of the interviews on video. And all of those program directors were in town for the EIS and the International Night from a couple of years ago. And now all of those people that you saw in the video, none of them are in their current positions that they were in with FETP. Everyone has changed. Everyone is doing something different now. So talk about changing leadership. I'm sure these are some of the things that you are having to deal with on a regular basis with your FETPs. Funding, always a huge part. The investment. Program placement. Is the program placed in the right place within the country to do the most work? I would love to hear your thoughts on how any of this is resonating with you, if these are issues that you yourself are dealing with. If anyone has a hand up, would I see a hand come up? I'm not sure. Okay, moving on. Other themes I heard: determining roles and responsibilities, showing your results, documenting your results, And it was also mentioned about planning a workshop. So as I've said before, many questions, many answers. The individual journey of FETP and sustainability is just that. It is an individual journey. So we've talked about the destination, building an FETP that becomes a nationally owned, sustainable asset. But how do you get there? FETP programs create the greatest value when they become more than a successful training program. Their greatest impact comes when they are recognized as essential components of a country's public health system. Embedded within the Ministry of Health or the National Public Health Institute structures, supported by national policies and financing, an integrated workforce, public health decision-making, all centered around the FETP. That transformation doesn't happen by chance. It requires intentional planning. As FETP managers and leaders and stakeholders, you are responsible for helping to define your program's institutionalization journey. You need to demonstrate the value of your FETP, understand where the program stands today, define where you want it to be, and identify strategic actions that will move it toward the long-term sustainability that you want. So where do you start? Our featured presentation introduces a practical framework for answering that question. Through it, you will learn how to assess your program's current level of institutionalization, identify strengths and opportunities for growth, and develop a roadmap for building a sustainable, nationally owned FETP. Whether your program is just beginning this journey or has been operating for many years, the principles that you will hear today can help guide your next steps toward making your FETP an enduring national asset. So without further ado, I would like to introduce you to someone who actually started at CDC on the same day that I did many years ago. Our Senior Public Health Advisor, Workforce Strategy and Partnership Development Team Lead here at CDC, Mr. Bassam Jarrar. Over to you, sir.
Thank you, Ken. And good morning, good evening, good afternoon, greetings, everyone. Okay, the presentation. So I am going to talk about FETP institutionalization, the benefits of why we want an FETP to be institutionalized. And I don't think many of the things I'm going to mention are new to you or strange ideas. I think we have all kind of known that and thought about it in different ways. Next slide, please. So I know we probably all know the history of FETP, but it doesn't hurt to mention that FETP started back in 1951 as the Epidemiology Intelligence Service Program here at CDC. And since then, it has spread across the world, as you can see in the map. Most countries in the world are covered by FETP. We have, I think, more than 117 FETPs around the world, training field epidemiologists across at least 150 countries. Next, please. Next slide, yes. So FETBs around the world continue to grow with more than 2,400 graduates. And I think the number is a lot bigger than that based on what I have seen and my own observations. Major outbreaks have led to growth of FETBs and increased number of graduates, as happened with Ebola outbreaks, as happened with COVID-19 outbreak. Next. And I think we're all familiar with the model of the FETB and the three pyramids, the frontline or basic FETB, that's 3 months, the intermediate, that is 9 months, and the advanced FETB, that is the 2-year program. Next. So with that quick history, I'm just gonna go over some of the benefits that we have seen that we probably heard about before, and some of those benefits have been demonstrated in the video that just we watched. Next. I think it is really important to emphasize that FETB is not just a training program. FETB does train field epidemiologists, but also provide services for the Ministry of Health and for the country. And those services are not only during the training, but they really continue after the fellows, the residents graduate. The most obvious, of course, of these benefits is the training in outbreak response and detection, which leads to faster intervention and breaking the chain of disease, saving lives, and also preventing disabilities and injuries. Next, please. Now, of course, as we all know, one of the key elements of FETB is training on data analysis. And the training on data analysis not only happens during the 2 years or the 9 months, but it is something that leads to continued routine data analysis and creating that culture within our institutions. And having data lead us and lead decision makers to basing their decision on evidence. And with that, the goal is to improve lives and to improve health of people in the country. Next. And of course, next slide, please. Okay. And yeah, and of course, during those years of FETB training, we all focus on assessing data and assessing quality of data, which lead us to identify gaps and help us to come up with solution to fix those gaps. And at the end of the day, we will have better data that helps us make those decisions and improve public health programs and public health outcomes. Next, please. And as I just mentioned, so as I just mentioned, that training in data and assessment and program quality also happens during the training and continues. I've seen that continues with graduates after the training. Evaluation of public health programs is very important in order to, again, identify gaps, find out challenges, obstacles, which lead us to improved health services for the populations. Next, please. And to the benefits of FETB is not really limited to just the health aspect. It really has a big impact on the economy of the country. We all know that any outbreak among animals, for example, can lead to a lot of losses in terms of the profits, in terms of businesses. Outbreak of diseases also impact travel, impact the movement of people, impact trades, and affects people life and affects people livelihood. So as we have seen in many cases, like the early detection of avian influenza has led to and also in the recent cases of Ebola, actually identifying cases in surrounding countries have led to economical benefits for those countries. Next. And the training we do in FETB also lead to improved in communication. And when we talk about communications, we are not talking about just scientific communication, which is really important aspect, whether that is the scientific presentations we do at conferences or the publications, but also improved communication to the public. And we saw the importance of communication and importance of communicating the right message to the public during the COVID-19 epidemic. Next. And of course, the benefits of FETB are not really limited to the country. If we are able to detect and respond to outbreaks in a timely fashion, that prevent the spread of outbreaks to other communities inside the country, to neighboring countries, and prevent the spread of these outbreaks and these diseases to the rest of the world. So there is strong benefit for having FETBs and the training for the global health security. Next. So again, just like a quick recap, having graduates of FETB, like I mentioned earlier, the benefits of the training is not limited to during the training, but having those graduates at the Ministry of Health in the public health system not only provide us with trainers, provide us for mentors for the following cohorts, but these graduates end up leading programs, leading outbreak investigations, and also, as mentioned earlier by Ken and in the video, we have seen FETB graduates rising to as high as ministers of health, deputy ministers, and leading major public health institutions. Next. Okay, so now we're going to talk directly about the institutionalization and the importance and the key factors in the institutionalization. When the FETB is woven into the fabric of the Ministry of Health or a public health institution, it becomes a pillar of the national public health infrastructure, outlasting individual leaders or administrations. Imagine a future where your country's public health system is equipped with a steady stream of highly trained field epidemiologists year after year. Institutionalization of the FETB makes this a reality. And here are some of more basic strategic reasons. Sustainability. Institutionalization of the FETB is a major step to lead to ensure the sustainability of the FETB and that it continues to exist and operate beyond their initial funding cycle or pilot phases. It also helps build capacity. Building for epidemiologists does not really stop by graduating a certain number or by reaching a 1 per 200,000 graduates. We know that there is turnover, people leave, people retire. So the capacity building is something that really continues for years. Then again, the consistency and the quality. Institutionalization of FETB establishes standardized policies, procedures, and governance structure for program implementation. This ensures consistency in quality and adherence to the best practices across different locations or contexts. Then, of course, there is the strategic alignment. FETP or institutionalized FETP benefit from established mechanisms for accountability, monitoring, evaluation, and ensuring the program continues improvements and responsiveness to evolving public health needs. Institutionalizing the FETP aligns the program's objectives and activities with the national public health priorities and strategies, ensuring that its output directly contributes to addressing the country's most pressing health challenges. Accountability and monitoring. An institutionalized FETP benefits from establishing mechanism for accountability, monitoring and evaluation, ensuring the programs continue to improve and to be responsive to the changing public health needs. And also when the FETP is institutionalized, your public health leaders can confidently allocate the necessary resources, knowing that the program is an integral part of the national health security framework. And we cannot forget the institutionalization learning. Institutionalization of the FETP becomes a source of continuous learning and knowledge sharing, enabling the organization to adapt, innovate, and stay at the forefront of public health practices. It facilitates organizational learning by capturing and disseminating lessons learned, best practices, and successes from the program implementation. And of course, there is a whole world impact of the FETPs, FETP graduates collaborating with each other. And also we have an international effort right now within the GFIB to help guide towards program institutionalization. Next slide, please. Now, what do we mean by institutionalization? And I know there are a variety of definitions of institutionalization, but the definition that has been largely adopted and agreed on defines institutionalization as the integration and utilization of the FETP within the structure and operations of the Ministry of Health or a public health authority, which offers management, operational, financial, and technical support to the program. Next. So, as mentioned earlier, institutionalization is a really phased approach. It starts at the inception of the FETP as we are thinking about the program. So it is phased in approach. It is an incremental process. In order to guide this process and assess where a program is in terms of the road to institutionalization, we have developed 7 indicators. Each indicator has 4 levels: limited, developed, achieved, and advanced. Analyzing and looking at this level would help us to develop a roadmap to guide the process and establish specific target and timeline for the destination of having a fully institutionalized, sustained program. And as I just mentioned, and as probably you heard earlier, it really starts at the very beginning, at the inception of the program. And it is not limited to new programs. We can start this process at any point in the life of the FETP. Now, the 7 indicators, which I'm sure many of you have seen, focus on organizational integration within the Ministry of Health or the Public Health Institute, program oversight as an advisory board or steering committee, and also having strategic plan and strategic direction for the FETP. Another one of the indicators is the technical support. And where does that technical support comes from? Of course, a program cannot be successful just by having strong technical capabilities. Management, administration, and operation are critical component of a successful program. And again, sustainability institutionalization requires financial support. Those indicators show us how we progress from being dependent on outside sources to becoming fully government funded FETB. And again, the goal is that FETB is utilized by the Ministry of Health and utilized by the country. And so that is our seventh indicator. Next. Next. Okay, so we start actually, as I mentioned, we start by assessing the situation of an existing FETB. And this can be used with, and I have seen it used with the intermediate and with the advanced FETB. I mean, using the metrics to gauge where the program is. Next. So how do we do this? We take each one of these indicators, and normally the work happens in a group setting. The group setting can include FETB resident advisor, technical advisor, Ministry of Health, or National Public Health Institute, other stakeholders, CDC headquarters support staff. So it is a collaborative process, and the group of people, we have seen it in terms of people coming together in a workshop and having a series of questions to answer in order to determine which level the FETB is. And I think we can kind of like forward through the next couple of slides. So as you have seen in this slide before, we circle where we are in each one of these in each one of these levels. And once we complete that and we do the whole seven indicators, another really important step is to conduct SWOT analysis, which is basically looking at the strength of the program, the weaknesses, the opportunities, and the threat that faces the program. Next. Just for a quick definition of the SWOT analysis. Next. So strength is the internal attribute of the program or the activity that we're looking at. And with the FETB, we look at what are the strength of the FETB and the contribution of the FETB in terms of achieving its goals and its objectives. So strength is an internal kind of like looking at the program itself. And so is the weaknesses. Next. So weaknesses is also looking at the internal characteristic of the FETB and what hinder its ability to achieve its objectives. The next two, the opportunities and the threat, are external. So we're looking at, with opportunities and with threats, we're looking at the external elements that could help us achieve our objectives, and with the threats, those external elements that could prevent us from achieving our objective. So next, please. So once we complete our analysis or assessment of the metrics, we complete our SWOT analysis. Now we have to sit down and start developing a work plan, developing a strategy. How can we address those weaknesses? How can we take advantage of our strengths and our opportunities? And how do we move in terms of the indicators? How do we move from one level to the next? This actually in my mind, the process starts by developing a vision. We have to know what state in the future we want to achieve. Once we know that, then we have to figure out what is the mission of FETB. What does the FETB can do to reach that vision, and the core values. What does actually guide us to reach our vision and to carry on our mission. And also, we have to identify the stakeholders, those people who are going to help us achieve our mission. Next. So with all of that, we begin developing our institutional plans, and also developing a table that includes smart objectives that are specific, that are measurable, achievable, and attainable. Next. There are different formats for having work plans. And this is just like one example. Normally, a work plan, whether it is an annual work plan or strategic plan, starts by having the background and history of the FETB. We have to keep in mind not everybody who is going to look at this plan or review it is familiar with the FETB. Often, top decision makers don't have the same familiarity of the program. So we give that background, we give a quick history, and we state our vision, our mission, and our core values. Then the third elements of this institutionalization plan is actually the results of the work we have done, assessing the institutionalization matrix and the result of our SWOT analysis. The fourth element is the plan itself. Our goals, our objectives, and then we move to the specific, measurable, attainable, realistic, and time-bound objectives for the FETB. And identifying with each one of these objectives and activities, identifying actually who is responsible for those activities. And we have to identify our current and our potential partners, because again, this is, and as it is with all phases of the FETB, it is a collaborative process. There are many people who walk along this road with us. And finally, we have to have an evaluation plan. There are no plans that stay static and don't change. We have to take periodic looks at where we are, assess the progress we have made, and make adjustment. Next. So this is what a work plan or action plan might look like. We have goals. Under each goal, we have objective. Under each objective, we have a number of activities that allow us to actually reach that objective. Next. Now, many FETBs have been really successful in terms of being institutionalized, being totally supported by their country. Now, when we talk about FETB being institutionalized, being supported by the country, that doesn't mean it does not collaborate, it does not work with other FETBs, with other institutionalization, including CDC. What we have is a family of FETBs. We all work together to collaborate and to make sure that FETB and the FETB community are successful. So these are just a few examples of FETBs that have been fully sustained and functioning under the Ministry of Health. Next, please. And there is no one model that really fits all FETBs. I have seen FETBs being institutionalized in different models. One example that comes to mind is the Iraq FETB that was established back in 2009. They took actually the approach of establishing an FETB unit first at the Ministry of Health, and then The unit evolved into becoming a section at the Ministry of Health. What does that mean when it became a section and then later on when it became a department? It has a place on the organizational structure of the Ministry of Health, meaning it got dedicated staff and it got dedicated budget. They took that even one step further and establishing FETB units at each one of their governorates or the regions they have in the country. These FETB units continue to support the training, but also provide services to the governorate and to the country. Next. Another really good example is the Colombia FETB. It was established back in 1993. It started getting integrated into the national health plan in 2004, which means it got its own staff, it got its own budget, and then became accredited by TEFINET. 2021 expanded and started the intermediate program, and also later on the authority to provide a certificate and a master credentialing for the FETB. Next. Again, another approach is actually establishing a unit. The Egypt FETB was started in 1993, and in 2000, they established the epidemiology surveillance unit as part of the preventive care and endemic of the Ministry of Health. Again, that meant they are on the organizational structure. They received staffing. They received dedicated budget from the country. Next. So again, the key factors that really we want to emphasize when we talk about institutionalization and why we want the FETB to be fully sustained and institutionalized is it gives the country secure ownership of the programs. Country is responsible for the governance, for running the program. It's committing financial resources that allow the FETB to continue. It allows the FETB to have monitoring evaluation plan, maintaining the quality of the work, and also be an anchor and play a major role in the career development of the FETB graduates and the increased responsibilities they will be having, and continue to have impact on the communicable and non-communicable diseases in the country. Again, FETB is really investment in the human resources and the human capital that a country needs in all different aspects. And again, like I mentioned, we don't do this in isolation. An FETB in a country is part of a community, whether it is at the regional level, represented by the regional networks, global level represented by TEFINET, and other actually, factors and groups. Next. So this is kind of like, quick look, a quick impression of how do we move about institutionalizing the FETBs. And I really thank you for your attention. And again, this is a road that we all will walk together. Thank you.
Okay. Thank you, Bassam. All right. Let's open it up for questions, comments, thoughts, clarifications. Going through the chat room now.
And as Ken is looking at the chat room, I mean, in my mind, there are two recent experiences of how we really move this process. We did in two recent examples in Cambodia and in Tunisia. We had a workshop where we had a representative, of course, from the Ministry of Health, FETP leadership, Ministry of Agriculture, representative from the Human Resources Department, Finance Department. They all came together in the form of a workshop, did the analysis of the SWOT analysis. They looked at the metrics, did the analysis, and actually worked in developing plan. Cambodia a few months ago actually developed a very strong strategic plan that was approved by the steering committee, and we have already seen actually results of the plan and specific actions being taken by the country, by the government toward the institutionalization of the FETP.
Meg, please go ahead with your question.
I think we have a lot of interference.
Yes, please go ahead.
Thank you.
I'm sorry, but we are not able to hear you.
Is my voice clear?
Yes, okay. Yes, please go ahead.
Yes, my question is, you mentioned that FETB is a platform of different partners working together for one common goal. But I am a little bit confused about what do you mean by integration? Is the integration of the structures of the ATB or the integration of the idea of the FETB? Can you elaborate more?
Yeah, thank you for the question. I mean, everything starts with an idea. So definitely the idea comes first, and actually getting people familiar with FETB and the idea of the FETB. But also it has to be demonstrated in real life. And that happens by having the FETB integrated within the structure of the country's public health system. So we have seen FETBs that exist outside the Ministry of Health. For example, FETBs that are housed at university. Sometimes that can be beneficial to a country, but again, I think the FETB is a lot more effective and a lot more useful when it is part of the structure of the public health system, whether it is the Ministry of Health or a public health institute. And throughout the years, what I have seen, FETBs that are more effective are housed actually in the right part of the Ministry of Health, in the right section. For example, often we see in them FETBs where data is, where surveillance takes place, gives better access to the data, better access to identifying and responding to outbreaks. So integration is definitely integration within the structure of the public health system in the country, in my view.
Thank you, Bassam. So far in the chat, there are many thank yous for a great presentation, informative presentation. Many requests for your presentation. They want your slides. Yeah, many thank yous, many thank yous. Are there any more questions, comments, thoughts? Well, once again, Pamela, please. You may come off mic. and ask a question. Pamela, are you there? Okay.
Okay.
Okay, I see. There we go. Okay. Yes, I can hear you now.
Yes. This is Pamela. I'm in Uganda. So I've seen countries do innovations around other trainings aside of the surveillance and all. Like they go on to do One Health trainings. Um, and I wanted to ask whether there is a possibility to collaborate and have a training that is related to biosecurity, biosafety, considering this has also been one of those areas that have been neglected in terms of people who are trained and building capacity. So I would like to know if there is a possibility of having a collaboration to train fellows in biosecurity, biosafety.
So, I cannot probably comment specifically on training in biosecurity, biosafety, but what I have seen many FETBs do, whether it is, again, being adaptive and developing specific training to meet the specific needs. I mean, we have examples of, excuse me, of FETBs developing non-communicable disease training because those are the challenges faced by their countries. And those trainings that sometimes happen during the 2 years and other times actually as a post graduation after graduation as continuing education. We have seen FETBs where they identify need for leadership and management, developing leadership and management training. So I think collaboration, I think with partners to develop specific training, to meet country needs is really definitely something that's on the table and something that is possible. And for us at CDC, I think one thing we can do sometimes is help establish those links with the subject matter experts who can assist. I think the big example of how we are innovating and how we're changing is the One Health and how One Health now is integrated in the frontline and also, the new intermediate curriculum that hopefully will be ready in the next few months. So I don't know if I fully answered the questions, and of course, if, everybody is welcome to add.
All right, we have some questions in the chat. I'll read the first one. Thank you for the insightful presentation. In many settings, program success depends on a few highly skilled individuals rather than institutionalized systems and processes. From your experience, what practical strategies have been most effective in helping ministries of health shift from person-dependent programs to systems that continue to function regardless of leadership or staff turnover?
Yeah, thank you for the question. And, I'm just going to say a couple of things, and I'm sure Ken has maybe things to say about this. To start with, and what I have seen, the importance of leadership. Having strong leaders for the FETB goes a long, long way to not only to have a successful program, but actually toward the institutionalization of the program itself. Now, leadership comes and goes, so it's always important to think about succession plan and developing those next generation leaders. But what I have seen is a number of things. And again, different countries have different approaches. I think the example of Iraq, for example, is it's an important one because they created a structure within not only the Ministry of Health, but also at the regional level, that now it doesn't matter who is the director of the FETB, who is the undersecretary or the deputy minister. This is going to continue. It's part of what the country does. It's part of their structure. Another thing is actually the career and the career path. And for the FETB to continue making sure that in our civil service systems, for certain positions within the public health system, we make a graduation of from an FETB as a requirement or at minimum as something that is preferred. We have seen that in Pakistan, where there are many, and other countries actually, where being graduate of the FETB gives you extra points and preference for a number of positions within the Ministry of Health.
Thank you. And in addition to everything that Bassam said, I'll add that creating that value, continuing to have FETPs do good work, do great work that is appreciated by the Ministry of Health, that is appreciated by the National Public Health Institutes, because as you know, and even out, like as you get out into the districts, once people find out what FETPers can do, they want them. So that want and that desire is something to kind of keep the drive going to where FETP graduates are desired, they're wanted. Everybody wants to keep the program going because they know the value that those individuals bring to establishing public health in the country. All right. Next question.
And I want to also add that, as much as we really don't want to have epidemic and big outbreaks, but as we saw with COVID-19, FETBs in every country, we've been to, FETBs showed their value and they became recognized as the responders, as the people who were out there trying to control the disease. So FETB had that opportunity to demonstrate its value, just like Ken said, and continue to demonstrate its value. Because once countries' leadership recognize what FETB can do, they continue to rely on the FETB. Over.
Next question. How many countries have already institutionalized FETP, and how many years does it take for the program to be institutionalized? Trick question.
Have really a count. But some of the, like one of the slides I showed where we had some of the countries like, Thailand, Philippines, Taiwan, Iraq, Egypt, Morocco, and I'm a lot more familiar with programs in Asia and Middle East and North Africa. But there are a lot of FETBs that have been institutionalized, and maybe this is something we really need to kind of have a count. We have a technical work group for the institutionalization of the FETB, part of the GFIP, the global effort in terms of FETBs and what FETBs can do. And so probably this is a good task for our technical work group to try to figure out really how many FETBs and actually this is work that is being done. How successful FETBs in terms of institutionalization, what are the key factors and what are those factors that can be applied regardless of the situation in the country? So more to come with that. Over.
I'll just add to that the whole process of FETP institutionalization is a fluid process. It remember, it's more so like the journey that gets you to sustainability. So there are different levels to being institutionalized. You may have one area, management, leadership, kind of covered, but the other areas may be fleeting. So you can have, as you saw from the presentation, that there are different levels of different categories. So it's really like a hodgepodge, and it's hard to define and say when exactly you've reached institutionalization, because it's not like a light switch that you just flick on and off like instantly you made it. Because in our next webinar, we're going to go over the document, one of the tools that we've developed, the institutionalization matrix, and it talks about all of these different categories that Bassam explained, and there are different levels to it. So um, yeah. Uh, Next question. For countries with very small public health workforces, where individuals often wear multiple hats, should institutionalization be measured differently from larger countries? How do we distinguish a resilient system from one that simply has committed people?
Thank you for the question. And the two most recent countries I work closely with, in terms of developing the plan, they really identified specific indicators and factors for their country. So again, it's so this is not something like written in stone. This is more of a guide, and every country has a different situation and different factors that can impact this process. There might be other indicators that can be added, and I've seen that where countries added a specific indicator because they felt it is really important, for their country and for their FETB. So it is an adaptive process, and for us here at CDC, we stand ready to help, whether it is by, working closely in terms of being in the field with you, or, working virtually, to identify the indicators that are relevant to the country, the levels, and even to work on the assessment. Over.
Next question. You've described institutionalization as a journey. From your experience, what are the earliest signs that a program has genuinely become embedded within the health system rather than simply complying with an institutionalization framework on paper?
The first thing I really would like to see is the country, the government appoint someone to lead the FETB. And I have seen that happen when like FETB gets started, but also it becomes really important once we start having graduates. And so when I see, in my experience and from what I have seen, when I see an FETB graduate, preferably being appointed to run the FETB, I think that is really a good sign that the country recognizes the importance of the FETB and the institutionalization. Other steps follow. But without having dedicated Ministry of Health staff, it becomes just a project or something from the outside. And again, it is a gradual process that, we go through.
Great answer. Right. Next question comes
May I
through in
interrupt for
French.
just
Oh, yes,
I
go
think
ahead.
Cece's had her hand up for quite a while, and so I just want to draw your
Oh,
attention to Cece.
okay. All right. Yes, please go ahead. CC, how are you?
Great. Thank you so much, Ken, and thank you, Dr. Bassam, for that wonderful presentation. So in the definition of institutionalization, it describes FETP as within the Ministry of Health or the National Public Health Authority. How should the CDC institutionalization metrics assess university-hosted FETPs, where the university provides the academic home and awards the qualification, but the ministry leads the governance, determines the training priorities, or deploys the residents? Does the advanced institutionalization rating require that the program itself appear in the MOH or organogram?
So thank you for the question. And this is something that we are debating, and I think we have different views on what that means. In my mind, or kind of my own point of view in this regard, actually, is the service and how, because I have seen FETBs that basically exist in a university outside the Ministry of Health, and I'm not going to mention countries, where the utilization of the trainees, the fellows, the students is very, very limited during their training. And then after graduations, they go different ways. So it's very debatable. I think how integrated the oversight, the services with the Ministry of Health is a key factor. I personally like to see the FETB housed within the public health structure. Strong collaboration with universities is really important, and many countries actually have recognized the importance of engaging universities and having an academic degree that helps with the career ladder and recognition within the civil service system. So there are still different point of views, still debatable. And maybe by the end of our work with the technical work group, we can come to maybe more of clarity and consensus on that particular point. Over.
And I'll just add to that when you do have the discussions, the university should be a part of those discussions as well.
Yeah.
Because it can work in collaboration and in partnership. You make the final decision on really what it looks like, and it's not really a CDC decision to say that it should be here or should be there, because if it works for you in country, then it works for you in country, and that's what you go with. All right. Our next question comes through in French, but I've got the translation, and it translates to: how can we continue FETP training outside of the ministries of health? Which universities currently offer FETP training?
So I think this is a general question. I think there are a number of universities that offers a degree. Now, I've seen in some countries where really the admission process is 100% university admission process. People apply. Normally, they already have a bachelor's degree in health related field. They apply for the specific master's degree, and they get accepted based on the criteria the university established. I've seen other FETBs where the applications happen through the FETB in collaboration with the universities, meeting the requirements of the FETB as well as those of the university. But there are, a number of universities that also offer FETB training. Australia is one country I think of that is university-based, strong collaboration with the Ministry of Health. And I know many countries in Southeast Asia has graduates of Australia FETB that is housed at the university, and they have played a key role in establishing FETBs in their own countries. Over.
Right, thank you. And we have our last question. How can countries link with TWG in order to initiate the institutionalization process, especially countries in West Africa. TWG is that's the work group.
The technical work group. Yeah. So the technical work group right now is actually working on developing a roadmap and developing. We have had a lot of discussions. For example, the metrics that we showed, we spent a lot of time discussing that metrics. There were not many changes to it, but but it was adapted by the technical work group. And I want to mention that the metrics that you saw and that next webinar will focus on was not born like that. It was, I remember the early days actually when we were thinking about it. And I think probably one of the first people who used it, I used it in, again, in planning, planning session in Bangladesh. And since then, working with countries, working with FETBs, it's continued to evolve. So the metrics, as you see it right now, is not the brainchild of one person or one institutionalization. Again, collaborative effort. Every time we used it in the early stages in a country or working with our partners, it evolved and it got to the shape where it is now. So I don't know if the technical work group will actually be providing technical assistance to countries, but like I mentioned earlier, we are ready to help in every possible way, virtually, in person, but also our regional networks and TEFINET, the global network, are also good resource for help in developing these plans and moving toward full institutionalization. Over.
All right. Thank you, Bassam, once again for your great presentation. So in wrapping up, we do plan to have another webinar. And this is actually a series of webinars that we will have focused on FETP institutionalization. The next one should be in August, but stay tuned. Check your emails. You'll get an update when the date has been finalized. But in our next one, we will go over some of the tools and services that we offer and provide to help FETPs with institutionalization, including the institutionalization matrix. And we'll be introducing sort of like an opportunity to have like a one-on-one discussion with us if your country is interested in looking at where your program is in institutionalization and sustainability, and how can we help to get to that next level. So stay tuned for that. And again, thank you for joining us. We greatly appreciate your attention. We greatly appreciate your presence. Continue to do good work. Continue to do great work, because you are. And that concludes our webinar for this morning, afternoon, evening.